Not to turn to a more negative question, but we do have this worrisome trend of the Delta variant. It's skyrocketing in Utah. What have you learnt about that variant and how to manage that?
Sure. So you're right. About half of the new cases, we can't sample every case, but we do pretty robust sampling here. 10 to 20% of cases that we're sampling to see which variants are here. And the latest data that we've got is about half of the cases that we're seeing in the state of Utah are the Delta variant. And what we know about that Delta variant is that it spreads more rapidly. It's more contagious, and there's really only one answer to stopping the spread of the virus, and that is vaccinations. We desperately need people to get vaccinated. The good news for Utah is that we are vaccinating above the national average by age group. So over the age of 65, 89% of people have been vaccinated, which is very good news. We were pushing, as the federal government was, to get 70% of adults vaccinated, those over the age of 18, by the 4th of July. We hit that this past week when we added in the federal partners who had done vaccinations with our state vaccinations. We were just north of 70%, so we're really excited about that. Now, the difference in Utah versus other states, we are the youngest state in the nation, and so our overall vaccination rates are going to be lower because we have a large portion of our state that are not eligible for vaccines, those under the age of 12, and again, we have more people under the age of 12 than anywhere else, and every younger cohort across the nation, the vaccination rates are lower. From 20 to 30, you're less likely to be vaccinated. From 30 to 40 versus 70 to 80. And so we have such a young population. Reaching that young population and helping them get vaccinated is really important. Now, we also know, again, that the virus doesn't impact younger people as significantly as it does elderly people. But to reduce the spread, we really need everyone to get vaccinated. And so we're continuing to push that here in the state of Utah.
So that brings me, I think, to an important point. We can't stop the spread at the moment with vaccines among younger people. And the WHO warned just today about this huge spread across 100 countries now of the Delta virus. When the virus is spreading, there are more opportunities for mutations. What other public health mitigation methods are you prepared to implement should they become necessary with the spread of this virus?
Well, that's a really loaded question because if it becomes necessary and what that means, and this is one area where I think we've all struggled and gotten this wrong in lots of ways. I've said for a long time that I wish the WHO and the CDC had behavioral scientists working side by side with their actual scientists. This is one of the issues we had and in fact, I was the one on a call with President Biden that said, you know, Mr. President, we have people that are getting vaccinated. We need to start acting like it, and he agreed, and we saw a change with the CDC within the week. The same types of changes and requirements that we made over the past year are not going to work going forward. They're just not, and they don't have to. That's what's amazing. If you look now, I know the WHO again is taking a worldwide approach. The vaccination rates across the world are so low that those countries should be incredibly nervous about the Delta variant. But when you look at what's happening in Israel, for example, yes, the Delta variant is spreading, and we are seeing some breakthrough cases, but the breakthrough cases are still very limited, and most of those breakthrough cases are asymptomatic. They went, I think, 10 days without having a single fatality for COVID, just the past 10 days in Israel. And so what we just need to do is get more people vaccinated. So when you ask the question, you know, what steps are we prepared to take? It's to continue to encourage vaccinations because that's how we stop the spread of this virus.